It can happen to anyone. It knows no color, no socioeconomic, it doesn't matter. Rich, poor, black, white.
I am just like anyone else.
I was diagnosed in 1994. I was 29 years old. My thoughts were make my funeral arrangements.
Terry has been living with HIV for 15 years. He is now 44 years old.
Been positive, diagnosed positive for 8 years.
All things considered, Sam is happy and feeling great. But without the Roper St. Francis Ryan White program in Charleston, neither Sam or Terry would be where they are today. The program brings compassion, faith, and excellence to people living with HIV and AIDS, helping patients with their medical bills and support.
We provide any services that we can that will help that person stay healthy. One of the biggest barriers to healthcare for many of our clients is the ability to pay for that care. So we remove that barrier entirely. If someone's not able to pay for their doctor's visits or their medications, we will fund that care on their behalf.
Being able to provide the services to clients is a huge relief. HIV medication is very, very expensive. It can cost up to $2,000 a month or more just for clients to be able to get the medications that are specifically for their HIV.
In its 9 years of existence, the Ryan White program has served over 1,500 clients.
Across the country, we've seen a leveling of HIV rates over the years, but in the Southeast we have the highest rate of AIDS deaths, and we actually have the most people living with AIDS now than any other region in the country.
We think that a lot of it is because of lack of education, people living in rural areas, so there's less access to care. We also think that it has a lot to do with our history of being very conservative. Sex and HIV and STDs and things like that just aren't discussed. So it's always, very hush-hush. And so people don't talk about it, so they don't learn about it.
Part of what we're doing is to encourage people to get tested, to know their HIV status, so they can take steps to protect themselves and those around them.
The other part of the Ryan White program is providing patients with services like doctor care, medications, housing, mental health services, and support groups.
I don't know who's going to see this tape or hear my voice and recognize it, but I'm okay with that. I'm okay with that. I'm confident enough within myself, and I know that I'm not a bad person, and I have a terrible disease, but I'm not a terrible person.
They have helped me in financially, but also emotionally.
But the Ryan White program cannot do it alone.
The bulk of our funding comes from the federal government, and we've had funding cuts across the years. So we're really having to look outside of that for additional funding sources.
Hosting fundraisers like the first annual AIDS Walk in Charleston and hoping for more support from the community.
We always are looking for ways to supplement the grant funds that we get, because it's never enough. We are constantly, our program is growing. We get new referrals every day. Just this year we've had 103 new referrals.
Any private donations that are made goes directly to patient services. We don't supplement our salaries with that money. We don't pay overhead costs. It goes directly to medications and medical care for our patients.
Our clients range in age from 18 all the way up to 87. And our clients face stigma every day. And knowing that what we do, what the Ryan White program does, to help alleviate that and to help these clients live a fuller and happier life, makes all the difference in the world.